At the outset, I must thank Dr. Magan Malhotra and team for this invite by Surgeons Association Moradabad. And I am going to spend the next 20-25 minutes on just philosophical talk rather than showing what I can do robotically, laparoscopically, or whatsoever. I am not going into the details of it, but our thinking is, and the motto of my life, I strongly feel, is that inspire or expire means inspire or expire. Or I would put it this way, that all said and done, if I am able to inspire a young surgeon who is sitting at the back to do more professionally, to do more personally, in personal life, my job is done. And I bring greetings from Sir Gangaram Hospital and Bhatia Global Hospital and Endosurgery Institute. Anyone knows about this man? Young man, 19 years old. All of us know that now. So what I mean to say is, many times, many places, when I visit, when I go, then many young surgeons ask that how can we make an impact? How will we be able to make an impact in this society which is governed by so many senior surgeons all around? And you would notice that this was Messi when he was 20 years old, and the Lamine Yamal was 5 months old, and there was a UNICEF photography shoot, and in which the photograph was taken, the Yamal or Lamine Yamal, he was just 5 months old, and he was being bathed by Messi. And after that, this boy, from a very small village, he started practicing or playing football, and he carried on playing football, but he had an idol in his mind, that was Messi. And can you imagine, when he grew up, then he joined the same club, La Masia in Barcelona, and then he started doing the similar kind of movements which Messi used to play. For example, he was always a right wing player, and he would always use his left leg to push the ball into the goal. So our thinking is, ultimately, all of us, we should be responsible for inspiring our young generation, and we can do only by our actions. We cannot deliver, we cannot tell them that yes, honesty is the best policy and any and everyone should believe it. No, our thinking is that one has to inspire the young people so that they are able to tread that path. And again, I always ask, especially my younger colleagues, that are you a really adopter of the technology, or how many of you are using the artificial intelligence today? Hello? Anyone? 1, 2, 3, 4 only. How many of you are using the chat GPT? How many of you are using the Perplexity? How many of you are using the open evidence? So what I mean to say is, today is the day that we should never ever think that we are old enough or we are young enough to learn. We should carry on unlearning, learning and relearning. And our thinking is that today it has become such a easy task. Many times, many seniors, especially the senior surgeons, they start thinking that if I adopt the artificial intelligence, then I will be, obviously the mankind will be left behind and artificial intelligence will take over. No, artificial intelligence is not going to take over. It is going to show us the data in more organized manner, and whatsoever has been there, only that thing will be seen, rather than the surgical natural intelligent mind. Natural intelligent mind is always a creative mind. I must appreciate Dr. Madan Malhotra's efforts in organizing this conference, in this meeting. More important, I have been always impressed by his robotic skills. The way he started his robotic work in Moradabad, and then now he has made such a name in robotic hernia repair, incisional hernia repair all over the world. That ultimately makes a difference. So we should decide that are we the laggards? Are we going to be in this 16% of the people who will always think that we should not adopt the new technology, we should be left behind. And Moradabad is such a small place, how can robotic make a dividend for us? No, our thinking is that if you decide that you do not want to be the laggard, you do not want to be in 16%, but you want to be maybe early innovator, maybe in 2.5%, or all said and done in the early as well as late majority. So our thinking is, please come out of the excusitis. Anyone knows about excusitis? I always say that most of us, they start blaming ourselves and others that how can we afford to buy a robot? How can we afford to do laparoscopic surgery? How can we afford to go in for artificial intelligence? Please come out of the excusitis, and then you will see so much of difference you can create in the life of people. And this is again a very powerful statement from Wayne Dyer. Is the highest form of ignorance is when you reject something you do not know anything about it. Most of times when Dr. Madan Malhotra is speaking on robotic abdominal wall reconstruction, then many people will say that patient is not going to afford the robotic surgery. No, our thoughts are loud and clear that we should give our best. And if we are able to give our best to the patient, our intention should be that after Dr. Malhotra or myself or Paruru or any surgeon touches the patient, then the patient should not have any recurrence after that. Means we should believe, and we should believe on ourselves, and we should give the benefit to the patient that ultimately you are not going to have recurrence after we have done the surgery. So that should be our endeavor. And again, why did I show the photograph of Lamine Yamal was that he was born in a very poor family, but he had a big dream. And he could go into the World Cup and then ultimately win the World Cup for Spain against even the Argentina. So our thinking is that many times, many of us will suffer from excusitis and will not. This is a photograph with Marseille. Marseille is in Ircard in France, and this was way back in 2007. Dr. Arvind Kumar and myself had gone for robotic training. 2007. The robotic surgery was started in 2000, and we had gone, and believe me, I was not in Gangaram Hospital at that time. I was just running my own setup of 58 bedded Bhatia Global Hospital, and I knew that ultimately I will not be able to afford a robot, a Da Vinci robot in my hospital. But still I had that urge of unlearning, learning and relearning. Our thinking is that if you come out of that excusitis or you go into the different orbit and then you start moving and see the world around, then only you will be able to make a difference. And ultimately, I always say that only destiny writes these stories. Means Yamal story, that he meets his boss in World Cup in 2026 and ultimately defeats him. This is only destiny which has written. Similarly, can you imagine in way back in 2010, I was invited to Sir Gangaram Hospital, and then I was the chairman of Institute of Minimal Access Metabolic and Bariatric Surgery, and in 2012 we acquired the robot, and then we started doing the robotic surgery in super morbid obese patient, 350 kg patients, 400 kg patients, 84 BMI patients, and ultimately we could deliver the best to the patient. In those situations, the laparoscopic sleeve gastrectomy or laparoscopic gastric bypass is definitely a challenging position. So one should be, honestly, my feeling is that one should definitely come out of that excuse. And now I would just show small video clippings, not to frighten you, but this is in 2024. This is a 24 years old female, and this is a 17 years old female. And surgeon always thinks that it is a laddu gallbladder, right? And then he goes in and he tells his wife or children that I am going to do a laddu gallbladder and I will come out of the theater, just wait for me in the parking and I will join you. And after that, now you can see whatsoever structure is coming on his way. I am so sorry to say, but I am not going to name the surgeon, not going to name the hospital, but this has been in city of Delhi, and it is one of the primest hospitals in Delhi that one can see whatsoever structure is coming on the way, that is being clipped and cut, clipped and cut, clipped and cut. And ultimately, and most of us, I would say that most of us are insensitive. My request to younger colleagues is that please become sensitive. As Dr. Rishi Bhatia was mentioning, that today is the era of communicate, over-communicate. Similarly, our thinking is that medico-legal cases will never ever be there if you are sensitive to the patient's needs also. And in this situation, you can see whatsoever structures he is able to see, he is clipping. He is not bothered about anything. And this is a 17 years old female. Can you imagine that this surgeon is still going on with the surgery? He is thinking that if I convert this surgery into an open surgery, can you see the pool of blood? And anyone who can guess what could have been the injury in this situation? Portal vein tear. Can you imagine that the patient, 17 years old female, and she had portal vein tear, and then the hepatobiliary surgeon was called in that hospital. He was already there in the hospital, and then he repaired the portal vein. Then again, the cascade of events starts. Would you be surprised? Portal vein thrombosed. Again explode. So what I mean to say that please, for God's sake, if we are not ready to unlearn, learn and relearn, we will always be preserved in the museum. Our thinking is that please never ever become learned, never ever become that I want to do a fast surgery. This is a laddu gallbladder. I will finish off in 5 minutes, 10 minutes. Why? When people ask me that how much time are you going to take for my surgery, I always tell them, you want it a safe surgery or a fast surgery? I believe on safe surgery, and there is a safety in more safety. So our thinking is that these kind of situations should always be avoided. And only thing which one can do is, as it was discussed in medical legal aspects also, resist the temptation. Most of us are tempted, maybe because of money, maybe because of time, maybe because of lack of skills, and that is why we land in such kind of challenges. So ultimately our thinking is that please develop that resilience. For a surgeon, it is very, very important. There will be challenges. Safar mein nikle ho, dhoop to hogi hi hogi. If you say that you will not have any complications to see or look around, no, you are mistaken. You definitely, once you are operating, then you will have professional challenges. You will have the personal challenges also, but only thing is that we should be equipped in such a manner that we are able to give the best to the patient. And again, I would say that most important, especially for my younger colleagues who are there in the audience, is that please develop that resilience. धैर्य होना बहुत लाजमी है. So धैर्य होना is most important. And for this, again, we should define what is the purpose of our life. Am I here? Am I a permanent resident of the earth? Or my life is, you are gone. And today, I think we should all believe that 90 years or 100 years or whatever number of years we are going to live, that's it, full stop. We are not going to live forever. So our thinking is that we should earn good karmas rather than good money. Our thinking is that please, if your intent is good, if you are giving the best to the patient, I have seen many patients also coming to us, and they say that yes, my patient had died, but the surgeon was always with the patient, and that gives the ultimate answer. So he will not be dragged into the court. So our thinking is that we should become sensitive and we should identify the purpose of our life. That are we going to make a difference in the lives of the people, or are we going to just enrich ourselves and get out, and then nobody would remember us? So, and for this, I would urge especially my younger colleagues, that go and read the books, the motivational books, and I will be telling a few books afterwards also. But again, our thinking is that any day and every day, believe on 1% increment in the efficiency. Means we should believe on Kaizen, we should be believing on improving ourselves every day. I should be better than yesterday. Full stop. I should not compare with Dr. Madan Malhotra or Dr. Gupta or anyone for that matter. I should be better than yesterday, and that should become my professional challenge. And if I am trying to improve myself every day, every minute, and I am attending such kind of conferences also, and I am attempting to change myself, I am attempting to change for the better, definitely that is going to change. And again, please do not board the bandwagon, because one robotic surgery surgeon has started robotic surgery, so I will do the laparoscopic cholecystectomy robotically. No, our thinking is, will you be able to do the laparoscopic cholecystectomy better? I do single incision cholecystectomy, for example, every patient, and most of the patient, 90% of my patients go home with single incision, intra-umbilical incision. But if they ask me today, also in Delhi, I want the robotic surgery, I say no, I will not do it on my sister. I will not do on my daughter. So why should I give you 4 punctures of robotic surgery in which it has not been proven that it is better than laparoscopic cholecystectomy? So our thinking is that please maintain your integrity, and then only you will be able to do the best to the patient. And there will be, as Dr. Madan had chosen this topic of life beyond scalpel. So our thinking is that life has to be lived only once. So live it. Don't think that you are here forever. And second thing is, there is much more life beyond the scalpel also. Much more life. You should celebrate life, because ultimately all of us have learned in the COVID era also that people had so much of money, but not many breaths left. So our thinking is, and all of us today, 45 years old young surgeon dies on table. He was operating day before yesterday only, and we heard that he has died. So what I mean to say that why have that much of stress? So our thinking is, please learn how to de-stress yourself also. And please try to live life also. And if you want to live life, then yes, there are n number of disciplines, n number of commitments, but only thing is that we should be absolutely disciplined. For me, and Dr. Rishi Bhatia also knows me from life, from childhood, that I strongly believe on sar jaye par sair na jaye. Means when I was 5 years old, then I learned this, that ultimately I have to be fit enough. Then only I will be able to give the patient the complete fitness. If I am not fit enough, if I am not exercising, if I am not disciplined, then obviously I am not going to give the happiness to the people. So our thinking is that please cultivate discipline, please have daily habits. And can you imagine, today also I get up at 4 a.m. every morning, and then I do meditation, I do exercises, and then I visit Bangla Sahib Gurdwara every morning. Then I go to Gangaram Hospital, then I go to Bhatia Global Hospital, and then do the OPDs and OTs and whatnot. And on Sundays, I do the Sunday stories. So our thinking is that let us make it a habit It is a daily habit rather than only one day that we will be de-stressed and rest of the week we will be stressed. So our thinking is that yes, one should remain curious, one should always remain a learner, and discipline fuels the fire. Curiosity sets the spark and discipline fuels the fire. So our thinking is that please, if we are able to give the best to the patient, then definitely we should carry on learning from the patient experiences also. Many times I would just recite a small story. Can you imagine in COVID time, post-COVID time, one of the patients, he was operated elsewhere with robotic mini gastric bypass. And then his father was IG police. And they phoned me that the patient has been admitted in one of the hospitals and robotic surgery has been done, but he is around 170 kg and now he's not doing good. So will you be able to see him? So I said, no, I will not. I don't have the rights to visit him in that hospital. If you are interested, then you can come to Gangaram Hospital or Bhatia Global Hospital. I will see you. Can you imagine? Day 7, now it is day 7, they come to Gangaram Hospital and patient is quite hemodynamically unstable and he is on the verge of going. But ultimately we accepted the patient, as somebody was asking about the accepting the emergency or not. So we accepted and we started treating. Would you be surprised, Dr. Magan, a rider, would you be surprised the surgeon gave a phone call to IG police, the same father of a patient. Patient's name was Sangram Singh. So he gave a phone call to the father of the patient that whatsoever Dr. Bhatia is doing, it is not good. And patient is going to succumb. And at that time, we noticed that patient was having a leak and we had got the stenting done. And if I had operated, if I had touched the patient after robotic mini gastric bypass, 7-day leak, patient was in septicemia, hemodynamically unstable, I would have killed that patient. So I thought that yes, let us take the help of our gastroenterologist. And he also mentioned that in mini gastric bypass, for example, I have never ever placed a stent. So I said that I have seen enough of literature, and we have managed enough of sleeve gastrectomy leaks, so we can manage this by placing a stent in the stomach and in the efferent loop. And behold, the patient started improving. And patient remained in hospital for around 38 days, but patient walked off the hospital. And today also, and can you imagine what was the answer to the surgeon who had phoned the IG police? He said that we have full trust on Dr. Bhatia because he goes to Bangla Sahib Gurdwara every morning and he prays for our patients. So that was the trust which they had entrusted on me, and honestly, I never wanted that I should not reciprocate the trust. So our thinking is, yes, in society there may be lack of trust anywhere and everywhere, but our philosophy of thinking is that please do not prove the patient blind by not reciprocating the trust. So we should always reciprocate the trust, and ultimately that is going to make a difference. Now in this situation also, can you imagine small video clipping I am showing that patient had again a mini gastric bypass, but she had the ventral hernia, and the patient presented on day 3 with complications, with distended abdomen. And then I phoned the surgeon that what had you done for the hernia? He said that I did not reduce the hernia, but definitely I could see that the hernia was there. And at that time he was thinking of that patient is having vomiting because of his maybe anastomosis, the mini gastric bypass anastomosis, and that is why the vomiting was there. But we got the CT scan done, and on CT scan we found out that the hernia which was left behind, lot of intestines had gone in, and that was responsible for causing the vomiting. And ultimately we could do the hybrid repair in such situation and then repair this hernia, and then anyone would guess that what next step has to be taken. We have done the hernia repair by hybrid technique, by opening the abdomen by limited incision, repair the hernia. Anything which has to be anticipated? Anyone does bariatric surgery? Sorry, no. So our thinking is that In surgery, all of us have to anticipate. Can you imagine? Because the patient had presented with obstruction, because the patient had bowels in intestines inside the hernia, so we were having a suspicion that patient may have the gastrojejunostomy leak also proximal to the obstruction. And then we went in for endoscopy and we found out that yes, there was a leak. If I had missed that leak, then I would have invited the catastrophe. So our thinking is that surgeon should always remain a cerebral laborer rather than a manual laborer. One should never ever think that we can work as a manual laborer. We should remain sensitive. We should remain trustworthy. We should reciprocate that trust. We closed this perforation with the help of suture and the patient did well. And again, I would say that one thought which one can imbibe in this book is from normal PLA is that this is the power of positive thinking. So if you are positive, and if you are positive, then that these books definitely you will read and you will find out that you have also become positive. And more important is meet those people who are positive. I honestly, I always say that shun from negativity. Go away from negativity. And that has become a habit for me that I do not stay even for 1 minute with a person who is negatively thinking about anything in life. So I run away, and that ultimately has made a difference in my life only. And there will be definitely failures, there will be some successes, so we should carry on unlearning, learning and relearning. And there will be, for example, this was a patient of 84 BMI, and we were doing the robotic, Dr. Praroop will remember this when he was with us in Gangaram Hospital. Then we were doing the robotic sleeve gastrectomy, but when we did these check, recheck, cross-check, counter-check, saline irrigation test, then we found, and can you appreciate the bubbles coming out? So these bubbles are coming out because there was a leak at the gastrojejunostomy site, and immediately we could put in a suture and the patient did very well. So these are the advantages of anticipating, to advantages of robotic surgery, anticipating of doing and fixing the problems there and then only it is going to make a difference. So our request to all of you is that please have that attitude, never ever give up, never, because this is a frog, this is Parveen Bhatia, in the mouth of the stork. And there will be n number of situations in life also when the stork will think that today is the last day of the frog. But frog is trying its best to clinch the neck of the stork, and ultimately, can you imagine what happened? Frog survived and the stork was dead. And this is the mindset that one has to remain positive. And please, especially I would always tell to my younger colleagues also that leave a legacy. We have to leave a legacy that we cannot operate on all the patients. As simple as that. We should teach our younger colleagues as much as possible. We should leave a legacy so that ultimately we should not be remembered that yes, rich man has died. I would always love to be remembered as that a honest man has died rather than a rich man has died. And this is the last video clipping which I am just going to share with you, just to inspire you that there is much more life beyond scalpel. Also, you have to live life to the fullest. And this was, before the video starts, I just give a small history that this was around 2010 or 11. I had gone to my son who is in Da Vinci at the moment in San Francisco. So this was a Father's Day. And he had invited me, that he gave me a surprise on the Father's Day, that I have purchased a ticket of $200 and we are going to have a surprise at that time. And then can you imagine when we landed there, it was a skydiving place, and this was 18,000 feet that I was taken up, and now Father's Day gift. What is the gift from son?
Nice one. Son is jumping as well, yeah?
Yeah. He's
Hello, son. Nice present, mate. Alright, ready to go? Ready for takeoff?
Yeah, we are.
Good.
So whom this phone actually given? And honestly, I had the jitters when I found out what mistake I have done, that my son is going to jump first. That time I was tense, that what mistake I have done. I should have verified rather than going in for skydiving at that time. And now he is going, and this is 18,000 feet high on Pacific Ocean. Only the pilot and two riders, and now he is jumping. He is going to jump. And as soon as he jumped, then I had shivers that what I have done today. But after a few minutes, it was my turn. And when I jumped, then obviously the tachycardia had settled by that time. And then the parachute opened. There were two parachutes which were opened. And then ultimately I was at the best of my life, that I was enjoying every bit of it. And can you imagine, we were told that you have to land in a perfect manner when you are coming back to the earth, that you have to take both the legs straight and then land, rather than flex your feet and then land. And ultimately I landed. And both of us enjoyed, and the instructor asked me that, will you do it again? At that time I said yes, because life has to be lived once. So I will do it again and again. I'm not afraid of any kind of fear. And would you be surprised, when we landed, both of us landed, we had an excellent trip. Then my son showed me the YouTube videos of the same place, the Pacific Ocean. And then he showed me that somebody had injured the spine, somebody had injured the legs, and now he asked me again, would you do it again? I said yes, because life has to be lived once, so I have to do it again. And after 3 months, Dr. Binder and myself, we did it in Miami. Then after 3 years, again I did in New Zealand, and my wife did not do it, but I did it, and I enjoyed it. And anytime and every time, such kind of adventure sport is there, I am always there. Even I have done scuba diving, 35 meters down. I have done all these kind of adventurous trips also. Our thinking is, why should we be afraid? Only thing is, we should follow the instructions well. If we are following the instructions well, whatever instructor has told us, then definitely it changes the total perspective. If you are trained well, if you have learnt it well, and still if you want to practice that adventure, do it. So age is nothing but a number. And many times, we have been able to inspire so many people. I know he knows Dr. Arun Prasad also. After seeing my video, he also went there and he did skydiving from there. So our thinking is that yes, please come out of that excusitis. Come out that yes, there is a life which has to be lived once. Live it to the fullest, and enjoy it, and celebrate life every minute, every day, rather than just having an excelling in only in our surgical field. We have to live life to the fullest. And now I have landed, and my son had also landed before, and we were both safe, and we thoroughly enjoyed the trip. Thank you very much. Thanks a lot for your kind attention. Any questions you have, more than welcome to ask.
Thank you, sir, for the nice presentation. Only one thing, sir, what is your take-home message for all of us, for younger generations, maybe? One line take-home message, sir.
If you are not updated, you are outdated.
Thank you, sir. Thank you very much for this inspiring. Thanks, sir.
Thank you. Thanks a lot. And I would request you all that please learn robotic surgery from Madan, learn laparoscopic surgery from Praru, learn so many things are there. And if you want to remain young, carry on unlearning, learning and relearning. And that will make the total change in your perspective, and you would love to live life to the fullest. Many times, many of us are not living life. We are living deaths every day. We should live life every day. Rest in peace. No. Play. Live in peace. So that ultimately you are enjoying, and your family also enjoys. Your children are also inspired, and then they are able to do their best. Can you imagine? Dr. Madan also knows, Dr. Rishi also knows. My elder son is in San Francisco. He is with Da Vinci, and My Intuitive app, he has made it, and he is enjoying that. His wife is a gynecologist, again a robotic gynecologist. My younger son is a robotic bariatric surgeon in New York, and he did his residency in New York with Philip Shower. So our thinking is that if you are able to inspire our next generation, our job is done. Thank you very much. Thanks a lot.
Thank you so much, sir. I would request Dr. Sanjay Shah, sir, to give concluding remarks.
Hello. So thank you so much for a lovely talk. It was really inspiring. Really inspiring. And I think the most important word in your whole talk was sensitivity towards the patient. I think that tells them everything, and it's very, very inspiring about your skydiving and so many experiences. Thank you so much.
Now I would request the chairpersons to present a memento to Dr. Parveen Bhatia.
Lights on.
So many years.
Now I would request Dr. Parveen Bhatia to give a bouquet to all the chairpersons.
Group photos. Group photos.
Thank you.